Hello everyone. In today's topic we will discuss about the hypertension. So in this topic we will see about what is hypertension, the types of hypertension, the complications, the risk factors as well as the interventions. So in the next topic we will see this detailed about the pathophysiology, how the hypertension happens. And in this topic, so as you can see the blood vessel, so the systolic pressure, this happens when the heart contracts, and the diastolic pressure, it happens when the heart relaxes. So these are the two basic thing which we have to know when we are studying about this hypertension. So when this pressure has been increased, there is an increase in the pressure, then the hypertension happens. As you can see, this is a normal vessel. So as the blood flows very gently and no pressure, no major pressure is required. So as you can see, the hypertension, pre-hypertension, you can see the narrowing of the blood vessels. So there can be plaque deposition, that means the fat deposition can happen, or the narrowing of the blood vessels, it can happen. So in this is the narrowing of the blood vessels can be very minimal. So here if you see, this is a hypertension patient. For it will be there will be narrowing of the blood vessels will be too much, and the blood flow will be diminished, so the blood can't flow properly, and there is some pressure more than the pre-hypertensive patients. It is being little more than the pre-hypertensive patient. As you can see here, this is a very easy to understand between the difference. As we can see the difference between the normal, the pre-hypertension and the hypertensive patient. So introduction. Hypertension means high pressure in the arteries and most of the major organs. So there is an increase in the pressure mostly in the arteries that carries the oxygenated blood. So and most of the major organs in the sense the kidneys, the eyes, the peripheral arteries which carries the blood to the legs and the arms. So there is a increased pressure in these parts. So types of hypertension: primary hypertension and secondary hypertension are there. So primary hypertension is the hypertension without any cause or not related to any medical condition. It can happen just like that without the patient is having any problem prior. The primary hypertension can occur. And secondary hypertension, it can happen due to any other medical condition that causes high blood pressure. So mainly the problems in the kidneys, the arteries, the endocrine system. So these conditions can cause the high blood pressure. This is called the secondary hypertension. So the stages of hypertension. So as you can see, the normal BP level, that the blood pressure level is, if it is 120/80 or less than that, it is considered as a normal. So there is a smile elevated blood pressures. People, they don't call them as a BP, or we usually say it's a BP. It's a blood pressure. It's called as the high BP. So high BP or the hypertension. So there is a slight elevation in the more than the normal level. So if they are 129, if it is 120 to 129, and the diastolic blood pressure, when the heart relaxes, the blood pressure is 80. So if you see the upper number, this is the systolic blood pressure, and the lower number is the diastolic blood pressure. So systolic is the contraction and the diastolic is the relaxation. And the high blood pressure, that is the stage 1. So stage 1, stage 2 and the hypertensive crisis, they can categorize as 3. So in the stage 1 till before 140, that is 139, it is called as the 130 to 139, and the diastolic will be 80 to 89. So stage 2, it will be 140 or higher, and the diastolic will be 90 or higher. So the hypertensive crisis, this is immediately they have to seek the medical advice, and this is more than 180, and the diastolic is more than 120. So this is a structure which they follow for the hypertension, as we can categorize as them as elevated, stage 1, stage 2 and hypertensive crisis. So symptoms, so certain people have most of the symptoms, or certain people can have only few. It depend upon their body condition. So blurry vision, the sight of the patient will be blurred, and headaches will be more frequent, and vomiting and nausea will be there. for certain patients. Nosebleed will be there. Blood in the urine because of the effect of the kidney. The blood in the urine will be there. Palpitations because the heart is the major organ which is connected with this hypertension. The blood supply that is carried to the heart, the major coronary artery. Because of that, if that affecting the coronary arteries, the palpitations can be more, and the chest pain will be there. Shortness of breath will be there, and dizziness. Most of these people have dizziness. Might have come across so many patients where they usually says I have dizziness. So immediately we can link them to the hypertension. So these are the symptoms of hypertension. So not it is not necessary that they will have all the symptoms. Maybe one or two, or may even one will be there. So these are the things which can lead us to think that the patient is having a hypertension. And risk factors of hypertension. So these are the risk factors in the sense these people have most these are the factors that can cause hypertension. For example, as the age progresses, so if the patient is it's a baby or it's a small child, comparative to them, the bigger child, the adult people, they can have hypertension. So this is the age progresses, usually hypertension occurs. So race is African Americans, they have the hypertension. Family history, if a parent, the siblings or maternal uncle or paternal uncle or aunt, anyone in the family, they are having, mostly people will have family history, then the hypertension will occur. Obesity, if the patient is obese, no more than the BMI of their patient, then there is a possibility or chance of getting hypertension. Tobacco usage, because of the tobacco usage, the blood vessels will be narrowed, as we saw in the picture, the pre-hypertensive. So the tobacco usage, the narrowing of the blood vessels will be very fast sooner. So that can cause hypertension. Alcohol intake, that causes the hypertension. Stress, this is the main common factor. Because of stress, hypertension occurs. Pregnancy, some people get hypertension, but it will go away on its own as their after the pregnancy, after the delivery. But in some cases it can continue after the delivery also. So it's a possibilities there. And the chronic conditions like kidney problems or diabetes mellitus, if the patient is having kidney problem for so long, it will land up in hypertension. And as the diabetes mellitus, it is like a friend, so it also causes the hypertension in a patient. Complications. So in complications of hypertension, the coronary artery disease. Coronary arteries are the arteries that supply blood to the heart, and it is being damaged. So these are the complications in the sense if the hypertension is for so long, and it can land up in coronary artery disease. So it is like that. So the blood supply to the heart, that is being damaged, and the hypertension can lead to coronary artery disease. And peripheral artery disease as the narrowing of the arteries that supply blood to both the legs and the hands. So it is also called as hypertensive neuropathy. This is very common in patients. They don't have sensation in their fingers, their legs. If they get hurt also, it won't be they won't feel the sensation. So that can happen as the patient is having hypertension for so long. Peripheral artery disease is common. And kidney failure, so this can happen by the damage of the blood vessels in the kidneys. So hypertensive nephropathy, so nephropathy means it's been related to the kidneys, so that can also happen because of the prolonged hypertension. And eye damage, hypertensive retinopathy happens by the damage of the tiny blood vessels in the retina. Hypertensive retinopathy, this can happen because of the complication of hypertension for so long. So heart attack, it's very common, and it's a complication. And the stroke, it can happen due to the blood clot or bleeding in the brain. So these are some of the complications of hypertension. So next is interventions. So for interventions for hypertension, these are the home remedies which we can take, and which we can help in the prevention or reduction of the hypertension. That is, limit sodium of 1 to 2 grams per day. So 1 to 2 grams means a very minimal amount. So this can help in the reduction or the reducing of the blood pressure in a patient. So limiting the sodium and limit alcohol and the caffeine intake. As we already said that it causes the narrowing of the blood vessels. So limiting this can help in the helping to maintain the blood pressure, and increasing the intake of the fruits and vegetables and reduce the saturated foods and the sugars. So if you increase the intake of fruits and vegetables, automatically the fiber which is more, which helps to reduce the saturated foods and the sugars. These are the main culprits which forms the plaque or the fat deposition in the blood vessels. So if you automatically increase the intake of fruits and vegetables, then the reduction of the saturated foods and sugars can happen on its own. So these are the home remedies, but other than that, some medical interventions are required. So I have given a basic idea, so you can refer your pharmacology books with that. So thiazide diuretics and beta blockers, angiotensin 2 receptors, alpha adrenergic blockers, and ACE inhibitors. These are the common losartan and captopril, eosinopril. These are the some of the basic things. Metoprolol, which you come across the patients who are having blood pressure, very common. So these are medical interventions are required for the patient who is having hypertension for so long. So thank you so much. So this is just a basic idea. So in the next part we will see about the pathophysiology, how the hypertension happens and all. So thank you so much.